I did legs. I did legs and it went really well. And then I got to split squats and which is near the end of my lift. And they just got I was what's the word? I was compensating with my back leg. And so we had to get real with that, which meant I had to drop the load down. Fine. I had to take all the load off and I had to hold a 10 fucking pound medicine ball. Yeah, yeah. It was crazy. Yeah, I was training with Paul. So, we were doing split squats and my bad leg, my leg that's a little bit gimpy is my right leg using, so working my right leg. And so we always start with my right leg first. And so my right leg was the front leg in a front foot elevated split squat. However, because it's my gimp leg, what we realized when I switched legs to my strong leg, which is my left, I had actually been utilizing the drive from that right leg when it was in the back. It was driving me up, not my front leg. And so when I went to actually use my right leg, it was toast. Like it was shit. Got 4 reps and failed. And we were like, what just happened here? And he was like, I'm pretty sure you're using your right leg to get out of the bottom when your left leg or when your other leg is forward. And I think I just got my legs wrong, but y'all get the idea. And he was right. So dropped all load, went to a med ball because what Sarah and I are getting more into and talk a lot to our clients about is with regard to orientation of pelvis and thoracic spine. So holding that med ball for me helps line things up a lot better. Did you lift today?
I did lift today. I was laughing because I also had a split squat that I did not back the weight down on, and definitely made note for next time that it needs to happen because it was basically my pelvis and joints moving the load, not any muscle really.
Yeah. So when we dropped it to a medicine ball and I was holding the medicine ball and just really focusing on that front heel, I the movement felt incredible. Like it was almost like I was in this just space of no resistance. It felt really good, but it absolutely was incredibly fatiguing. Like my leg was not ready for that because I had been utilizing that back leg so much to drive out. Which is for me really tough. And I know like for you have a lot of mobility as well. And it's, I think, a blessing and a curse. But when it comes to holding tension throughout the range of the movement, and for me, definitely in the bottom, because I can crash to the bottom and that doesn't cause me pain. Like I just hit the bottom, I'll hit the ground before I get, painful, which is not a great thing, but it's hard.
That was such an aha moment with me, like working with Sean. Like we just did like just a body weight, like assessment, and I can squat ass to grass. But then what he was like pointing out was like, look what your body is kind of doing to do that. And I'm like, oh yeah, my it's almost like my femurs and my feet just like get out of the way so that my butt can drop down as low as I want. But it's like, yep. What are those joint, like, it's not like, and I hate to use the word supposed to, like, our bodies are amazing at compensating and doing what we want. But if the goal is to overload a muscle, that's not what was necessarily happening for either of us today, it sounds like, which is humbling.
We even did, so it was, for me, like, it's honestly legs, like, it is the biggest tell for me, because hence pelvis, right?
Right.
And we were doing front squats on the Smith machine. That's been really helpful for me, just to hold space. But for me, it's that we want to strengthen that full range that I do have, because I can hold tension in full range, but strength within holding tension is something that I need to work on. So if I cut my rep short, which for me, cutting a rep short means I'm still past parallel. I'm still getting a great knee flexion, but it's not my full range. And so if I cut that, I have strength and I can lift more, but I'm truly cutting what I can do in my capacity. And that's been very humbling too, because it's like, hey, do we just lift heavy, but have her stop like honestly 4 inches short? Or do we back that load down and work strength within that range? And that's kind of where we're at. And it's quite the mind fuck, but I also really fucking love it.
I get it. I very much get it. The latter, I feel like is often the move, even if it's hard. And that's not to say that, you know, it needs to be an indefinite phase. Like the whole point is to build back that capacity. So I
Yeah.
wanted to open with that too, because we were talking about topics for podcast and training in perimenopause, and you, my friend, are in premature menopause. So tell us a little bit about that, about what your thought, like maybe I should be a little bit more specific. Tell us how your experience maybe is different or not at this stage of your life versus 10 years ago.
Yeah.
Do you train differently? Do you think about things differently because of your hormones?
No, I don't. I think that's like a really short answer, but I truthfully don't. Now, I think that a good podcast and for us to make a note of for maybe later, especially with regards to like your history and my history with regards to amenorrhea. But was there a time in my transition where I had to communicate more than anticipated with regards to auto-regulating what my body was telling me? Yeah, because I did not go through a natural perimenopause. I didn't go through a natural menopause. I literally woke up with nothing. And because of that, not the fact that I woke up with nothing was I weak nor pathetic. It was all the changes going on within the system of my body. Truth be told, I had to come back from a surgery. So that was my biggest focus, not my hormones. And so that I had to be thoughtful in. But now that I've gone past that transition and I'm in a place where I'd like to say that I'm well managed with regards to my hormonal support, because I don't want to squirrel on this podcast and discuss about that transition. I really want to talk about where I am in now, which is in a surgical menopause. I do not train differently. I still strength train hard. I still work very hard. And I think that that's a big misconception for women in perimenopause. But something you and I were talking about is I think that people put labels on people as this overarching theme that when you're in your 20s, you should train like this. But that doesn't really work either, because as you and I both know, like what was going on in our 20s versus maybe like your sister's history or my sister's history. Like we could be two 20-year-old females and have incredibly different experiences and needs. And none of that has to do with the fact I'm 20 years old. Although maybe because of my experience in life, we can start talking about that. And I think that's the biggest thing with regards to perimenopause and menopause is understanding what is changing for that female during this time. Yes, baseline, we need to have those understandings, because is that going to affect perhaps how her body stores fat, maybe perhaps her sleep, like things like that that will translate to training and allostatic load. But because baseline, you are in perimenopause, is there a rule that regardless of what you're going through with life that you must do this? I don't agree with that.
I definitely do not either. And we should definitely get into some definitions, because a lot of women don't even have like a clear idea of what perimenopause means. So perimenopause isn't a day. It's a period of time. It's a period of change, a period of transition, going from our fertile years to eventually getting to a place where you have your last period, and then once it's been a full year, since that time, then you are now considered to be in menopause. So you are in that perimenopausal period, for, anywhere between, I would say, like, maybe 7 years is a bit of a stretch, but 7, years to, for some women, it could be a very abrupt, transition. Your history is a little bit different, but for some women, and then the period just stopped one day, and then, it was pretty, quote, smooth from there. But yeah, I do think, like, a lot of women are just confused. Like, am I in perimenopause? Well, you might be if you are, in that later, closing in on your 40s, late 30s, maybe closer to 50. Everyone is different, and you're different because of genetics, because of, whatever your body has been through over the course of your life that can impact things as far as the timing of all of this. But, if you are kind of roughly in that age bracket, and we'll have a whole other podcast about this, we want to really focus on training. Yeah, like when you see those scary social media posts about training in perimenopause and all this and that, like, they're probably trying to talk to you, but I would really encourage you to tune out and not listen to that BS, because like Mare was saying, no matter if you are 20 and you're wondering if you should cycle sync, or if you are 47 and wondering if you should be training differently now that you're in perimenopause, the answer is you should train how, and I hate to use the word should, but you should train how we always recommend male, female, purple, pink, blue, green person to train.
Yeah.
Auto-regulate, train hard, train specifically for your goals, and that's kind of it.
Yeah, I think that we both really appreciate social media, but we also, this is why we like longer form of content, because it doesn't tell enough of the story and it's not inclusive enough. Mm-hmm. However, it is just shiny enough to get somebody's attention. And in a world where we seek to belong to an identity, it really feeds that. I think a really good example that I hope will resonate with a lot of people is, say we have some women who are in perimenopause. One of them is a marathon runner, and that is her goals. Her goals is to be a really good marathon runner. Then we have another female who is in perimenopause, and she is into strongman competitions. We have another female who is a swimmer. We have another female who is just into bodybuilding. So we have this pool of females, and they all have different interests and they have different goals. Is it truly encompassing or fair to make a statement such as, if you are in perimenopause, you should be doing only zone 2 cardio? If you are in perimenopause, you should be lifting these sets and these reps. Well, how is that going to be serving to a female who's doing strongman when she needs to be strong as hell for potentially short bursts of time and move with propulsion? How is that going to be helpful to a person who her goal is to be a marathon runner, to which, yes, she should be lifting weights for injury prevention, strengthening ligaments, tendons, all the things, but to tell her that she should be lifting or must be lifting to succeed as a female as perimenopause, to do these sets and these reps, I hope you understand how these statements don't apply. It applies to the woman. It applies to the person. No more so than we can say that all 20-year-olds should be doing this. Well, you know what? All 20-year-olds, you should be strength training 6 days a week, and you should be doing this amount of cardio. Okay, so I'm gonna take a pause on that. If we had said that to a Sarah who did not have her period, maybe that wouldn't really be appropriate recommendation to, a 19, 20-year-old Sarah who didn't have a period and might be leaning towards, osteoporosis, right? Like, let's be thoughtful here. And this is where I think people get caught up in wanting to belong to a statement and hang on that as Bible of this is what I should be doing. And if they did that and then it didn't work, oof. If they did that and it didn't work, then they potentially have a scapegoat to say, I did it, it didn't work for me, it doesn't work. But are we really taking ownership there of our life, of our choices, by getting information that actually applies to us as an individual?
Absolutely. And it's funny that you use some of those examples, because as you were talking, I have 2 clients right now who are in perimenopause. One is getting ready for a half marathon, and the other one is just started a prep, so like for bodybuilding. So very different goals. Like my recommendations for training are specific for those goals. And for both, I'm looking out for signs of autoregulation. We're looking at, for my, half marathon, making sure she is fueling adequately for that, looking, and ensuring that she is balancing strength training for, injury prevention. Yeah, in the back of my mind, am I thinking that we're, wanting to consider sarcopenia and how as we age, and in, perimenopause, I don't think we even define this, but hormone levels are fluctuating. Estrogen in particular is fluctuating. Progesterone is starting to decline. And then estrogen eventually declines as well. Testosterone is lowering. So hormones are lowering, which does impact muscle. And we know that muscle mass is just gold and metabolically has so many benefits, longevity wise, thinking about like just supporting anybody as they age. Yes, we do want to have that base of muscle and continue to work to maintain that muscle. However, that's going to look very different depending on the person. I have, I know we both have clients who are, in that perimenopause age range, and they only started lifting, a year or 2 ago. Their training looks very different than those 2 clients that I just, brought up. We're working more, foundations. But again, what does it have to do with their hormones? Yeah, but like, that's not what I'm thinking about when I'm checking in with them every single week. And that's not what I expect them to think about. I want them to be aware and have this information. However, that doesn't mean that we get so caught up in the details that we forget like what the big picture is here. And I find that like those details also too just paralyze people. Like you were saying, like zone 2, like, am I in zone 2? Oh, am I in zone 3? Zone 3 is bad. I should only be in zone 5. HIIT training is terrible for my hormones. Well, one, are you actually doing HIIT training? That's a whole other conversation, because most people are doing a 45-minute HIIT workout and it's like, nope,
Circuit.
not it. Like that workout could have been 15 minutes, including your warm up and cool down, to actually be a HIIT workout. But how are you fueling for that training? Like that is the bigger conversation. And that's where like women got so lost, I feel, is we were led to believe that the body was the most important thing for so long. And that was the very strong popular message for so many of us. And we adopted habits and behaviors centered around fat loss nutrition and misguided fat loss nutrition at best, and at worst, crash diets and restricting and overtraining. And it's because of those, I'm going to say, fitness-born habits that combined with, inappropriate training and everything else led women to a spot where, yeah, maybe right now that intense training isn't great for your body because we're needing to recover. We're needing to start to learn how to fuel appropriately because your body has just been depleted for so long and in a hole. So it's not that training, if you were doing it right, was bad, but it's we weren't respecting training adaptations and we were misguided as far as goals, and we didn't understand how to push and pull. And that's something that Mare and I are super passionate about, is that it's not that you can't do these things or that these things are bad. It's that we have to balance, and looking at balance on a grand scheme, we have to have those ebbs and flows, those pushes and pulls to ensure that you are resilient to go after those big goals. And that's not to say that we don't push it too far sometimes, but then we have to pull back maybe a little bit harder. So, for example, like, my clients that are getting ready to do their half marathon and, bodybuilding prep, those things, like the last final week, they're going to be in a hole. Like my bodybuilding, prep last 6 weeks. Like we know that is not the picture of health. Running marathons, have you seen those guys' feet? Like, have we, let's look at the injury reports. Like,
Yeah. Stress fractures.
yeah. Like, but hell yeah, they're badass goals. And
Yep.
what are we going to do after? We're going to recover. And that's what, that period of their life is going to look like. And we're going to, ideally, be in a place going into those goals to be able to handle them, for lack of a better term, and come out and bounce back, fast.
Yeah. I think that a lot of women, with regards to perimenopause, something that you touched on and I think is really important, and then I'm going to kind of run with it, is they have put themselves in these compartments based on what they've been told is law that they should do, that like this is the way, like this is like they're looking for answers, seeking the body that they've never had, and it's like just constantly chasing. And so when somebody says they have it figured out finally, especially I'm going to say this age demographic, and that is where information and being informed about a client who is in perimenopause is looking at that age demographic and looking at exactly what Sarah said, the messaging that they have been receiving since they were, 12, 13, 14, 15-year-old women, because that is the information that has fueled them, literally, like Sarah said, with regards to their nutrition. That has fueled what they've not trained for. Again, a lot of these women that I'm going to say in I'm going to say early 50s and beyond, having muscle was like poo-pooed on. Being strong, athletic women, that meant that you were butch, that you were, all these negative, you weren't feminine, right? And so I love this time in life because we're all about being strong, but reframing that identity that it's truly an identity that we have known for years, that is very daunting and very scary. And so I think that, for the coaches listening to this, that absolutely, regardless perimenopause or even the 20-year-old, like know your client, know the demographic, take a step back. And then to the clients and the women who are in perimenopause, I would say stop putting ceilings on yourself. There's so many ceilings of what you can and can't do, should and should not do. And this goes back to, we want our clients to, yes, we should be working on building muscle because we understand what hormonally a female is going through, like Sarah said, during this time. We get that. And we also understood that these women should have, in the times that they were being told don't lift because you're going to be too butch, that's actually the formidable years of when they were, fortifying and building bone. That's the time when muscle was supposed to be packed on. And unfortunately, now we're this other time where if muscle isn't hard enough to put on, it's definitely hard to put on when your hormones are saying like, I'm done, babe. And so understanding that is very important, but that's not limiting. If anything, that's opening a shit ton of windows of opportunity that we have to maximize on. And that's something that Sarah and I are really strong on, is understand the client. So a person who is in perimenopause, understand what is hormonally happening in their body, have those discussions with them, but also empower them of, hey, like because of these things, we do need you lifting heavy. We do need you doing cardiovascular activity. Guess what? You want to look after your heart health, because by the time, once you become, post-menopausal, your cardiovascular disease risk goes up, my friend. So guess what? Doing some actual HIIT, which is not lasting 30 effing minutes because that's not happening. Doing some actual HIIT every so often, like, oh man, Sarah, you would know this because Sarah's my runner here. Oh God, I think it's like Nordic. It's like an interval, like 4x4s or something, like sprint work, like Nordic.
Working on your VO2 max, Norwegian, yeah.
Norwegian, that's it. I'm like Nordic, Arctic.
Yeah.
Yes, Norwegian stuff. Like that actually has been shown to be very beneficial. Do you need to be doing that every week? And this is where my women who are perimenopause, we have been taught, if you're going to do something, And Sarah and I are with you. We commit. When it's not that you have to do it every day, all week, every month for years.
I'm so guilty. As much as I see nuance and love nuance, as do you, I can be such a black and white person when it comes to my own stuff sometimes.
Yes.
But yeah, like
Yeah.
having that, and that's like, we could even like get into a discussion on like metabolic flexibility in the future. Like that's what all of that kind of comes down to. And yeah, like you said, seeing it at those as opportunities and things to get curious about and not have to be afraid of, because of hormones. I would say because of hormones, we get to be excited about them, actually.
Yeah, and it's even, I would, again, I hate to always go back to, someone who's in 20 versus perimenopause, but I think this is where we really want this message to be very encompassing. They matter now just as they mattered then. It's just now, I'm going to say it because I am there. There is urgency because it is scary when you see things happening in your body, to your body, that you don't understand and is out of your control. Like that is very scary. And I know that that's something that Sarah and I, we know personally. We've been there on many different levels, whether it's with family or not. When something changes in your body due to aging and you are doing all the right things, that is very scary. And I do think that during this time, because of what is changing with hormones, which can be changing in someone's blood sugars, their strength, their performance, oh shit, this is a big one. Their ability to be as resilient mindlessly as they were before. Because we've all been there where you're like, shit, like I'm going to call myself out. I remember going out to the bar and I remember walking into my dorm room with my alarm going off for me to wake up to go to class. And there is no worse feeling than walking in from a bar. And my first class, my friends, was a dance class.
Oh.
And let me tell you, that instructor, they effing knew. I mean, we looked rough. We had not been to bed, and we had been taking nothing but tequila shots, Jaeger bombs, 3 wise men.
Ooh.
We roll into a dance class, having to do turns across the floor. It did not go well, but I remember being able to at least show up and do that. Like, that's some kind of resilience. Now, not the resilience that we're promoting with our coaching, podcasting, or anything, but I'm just saying that's a very good example. There is no way in hell right now I could have a shot, let alone, maybe if I whiffed some rubbing alcohol, there's no way I would be put out for days. And when a female is all of a sudden like, I'm not recovering from the gym like I used to, like, why the fuck am I sore for 3 days later? That's alarming. And I think that this is where we have dialogues and say, hey, guess what? You aren't, we don't need to start building your grave now. We don't need to do the tombstone. However, there's some opportunities in training. And this is what Sarah was actually talking about earlier in the podcast, if we put that part in, when we were just kind of gabbing, where we say, hey, we need to pivot. And it's not because you suck. It's just because we need to adapt.
100%. And yeah, sometimes you just gotta work on some of those things harder. Like your sleep schedule does matter more now, and it just is what it is, hun bun, and that's the season of life. And that's okay.
Yeah.
Well, yeah. So wrapping up, I feel like you said it, but I'm going to put you on the spot. If you saw somebody coming into the gym and, she tells you that, she's, hey, I'm, 46, just kind of getting in here, again, like I've been kind of inconsistent. What unsolicited advice would you give her? And if she was asking you how she should be training right now that she's in perimenopause?
I would tell her to show up as often as she had planned. I'd hate to say, I don't want to say every day right now because I'm not promoting that, but I would say just keep showing up and be strong as hell. Do not be scared to take up space. Without a nuanced conversation, honestly, I'd be like, fuck yeah, glad to see you here. Can't wait to see you next week.
I love that.
Yay.
Well, you guys, let us know if you have any questions below. And We'll have to do a separate episode on maybe different phases of life, but you could probably guess that our recommendations are going to kind of boil down to a lot of what we said here. Never be afraid to chase strength, and that doesn't just look like squatting and split squats and all that. Strength, I think, looks like a lot of different things. And until next time.
Yeah. Have a great day, guys.